Thank you, Madam President. Good afternoon to everyone. Senator Thomas, it is very good to have you back, although it's my first time sitting in chamber with you. I want to let you know that I cannot begin.
Let me remind you, you're speaking only to the chair.
Thank you, Madam President.
You do it through the chair.
Thank you, Madam President. Through you, I want to say that whilst I cannot begin to imagine what the senator has gone through, I am very happy that she is here carrying on business as required. Madam President, I rise to share my concerns on the resolution before us for the Minister of Finance to borrow US $20 million from the Export-Import Bank of the Republic of China for the purpose of financing the COVID-19 response project. And Madam President, we can all agree that if we are not focusing on the health of our people, even more now in this COVID-19 era, we are going to be in great trouble. The most important thing is the health and well-being of the people of St. Lucia. Madam President, I want to take a look at how we have been managing COVID-19 and the reality for borrowing for COVID relief. Since we have borrowed about 160 million already, and today might bring us to over or close to 200 million. Madam President, the members on the other side have said that all the opposition continues to do is talk about borrowing and borrowing and borrowing. But Madam President, the issue has always been on prioritizing that borrowing and holding the government to account for borrowing funds and that it will be borrowed and used for what it is intended. Madam President, you will realize that it must be underscored that we must be transparent when we are taking in additional debt. So, like the leader of opposition business said before, a document was flashed accounting for approximately 15 million. And the leader of government business came today to account for an additional sum, what we are intending to borrow today. But Madam President, we still are yet to hear more explanation or a breakdown of what has been borrowed prior to. So we are still uncertain of all the borrowing and its intended use. We really would like to see, Madam President, that the government gives a full account of what has been spent on COVID relief so far. And we just cannot trust all of this boasting about how the government has managed COVID-19 when in the last few sittings of this House, we have seen more borrowing and borrowing for non-priority projects. It really concerns me, Madam President, that the money that we continue to borrow is being used for what is intended. Madam President, we take a look at the respiratory hospital recently painted on the outside, and we have seen through videos circulated on social media what truly is the state of the inside of those hospitals, of this hospital. We have nearly run out of beds, and quarantine facilities are nearly at maximum occupancy. And our St. Lucians are still paying for a room night, or what I would refer to as a room night at one of those quarantine facilities. Madam President, we need to come to grips with the actual management of COVID-19 because it will really help us understand why it is important for us to account for the funds that we are borrowing and where our priorities lie. Madam President, and when I think of this situation, I have to shake my head because at this point, I just really don't know anymore. The confusion that exists in the government, where we hear the Prime Minister affirm that cases experienced on island have come from the back door, and the CMO, which is the health expert, has said that there is no evidence to suggest such. Now, Madam President, if we are talking about a national health crisis, wouldn't you take the word of the expert? Wouldn't you take the word of the CMO? Of course, we would quickly listen to her when she has said that there is no evidence to support this notion that the fisher folk are allegedly transporting persons illegally into the country. And let's use Martinique as our neighboring island as an example, which has experienced over 5,000 cases. You mean if a fisherman is going to transport persons illegally, or fishermen are currently doing this, not one of them have tested positive for COVID-19? The Prime Minister came out to the media and he said that. And the CMO said that this is not backed by evidence. Confusion again, Madam President. And you just cannot trust the word of this government and how it intends to justify borrowing. Madam President, this COVID virus is a serious thing. Healthcare is a serious thing. And I just want to give you a short example of what happened to my family recently. My niece just turned 2 years old. One day she woke up, she wasn't feeling too well, and in no time her caretaker realized that she began to turn blue. She began to turn blue, and her eyes were already rolling to the back of her head. Fortunately, she got some assistance from a neighbor who came to wet her up, and I believe my niece was perhaps about to experience a seizure. The ambulance came, fortunately in time, and my niece was transported to the hospital. Madam President, when she got there, and she's allergic to penicillin, there was absolutely no alternative medication that she could have taken. And when finally an alternative was discovered at Tapio, the cost was exorbitant. And Madam President, I have to think about the number of families who really cannot afford health care in St. Lucia, but still the government does not seem to understand why health care needs to be a priority. What is wrong with second testing? Madam President, just last week, and my colleague, leader of opposition business, alluded to this earlier, the Minister of Health spoke of second and triple testing happening right here in St. Lucia. And only a few days ago, the Minister of Tourism took to the airwaves. And we know that key stakeholders like SLHTA have recommended additional testing. And this is not just to keep the tourists safe. This is to keep our people safe, their families, the workers in the hotels, the people of St. Lucia. Madam President, I just cannot understand what is wrong with additional testing. This is to keep our people safe. But the Minister of Tourism will not speak directly to how additional testing will benefit the people of St. Lucia, but he will begin and go on to question the motives of persons and organizations and key stakeholders who have been asking for additional testing. One member on one side says that we are doing additional testing, second and third testing, and the other member on the other side cannot seem to understand why it is important. Again, we are seeing discord and disunity in this government. And it is time that they get their stories straight, Madam President, and sing the same song, because we are speaking about the health of our people. Madam President, we just cannot continue to boast about how we managed COVID-19 in the beginning. We need to be talking about how we are going to prevent the spread of COVID-19 right now. If indeed we were handling it in the beginning, we were told to prepare for a second wave. Now the second wave is here. Some days we are seeing 20 cases, 16 cases. And Madam President, we still cannot see the need for us to engage in extra precautionary measures to keep our people safe. And we want to blame St. Lucians and say, oh, but you're all not wearing the mask. And we understand that there are situations where you may not be able to wear the mask. But as a government, the responsible thing will be to put additional testing in place. You can never be too cautious. And Madam President, another example, and we need to stop peddling this narrative because people at home, they're tired of it. Our young people, we all tired of it. This narrative that the SLP was reckless and irresponsible in hosting a march. Madam President, are you kidding me? Did the SLP take it on its own to host a march? No! The CMO granted approval. Again, I have to say, Madam President, that the CMO granted approval. The SLP went through the process to get the necessary approval to host the march. But you want to peddle this narrative that SLP supporters are surrogates. Madam President, the CMO again. And you see a trend here. She is the expert. She is doing her job. And at every opportunity, the government comes and contradicts what she says. If you have nothing to say, it's best you don't say nothing at all. And the people of St. Lucia are not fools. We can see right through this. Madam President, we are told that Caribbean leaders are confident in how St. Lucia has managed COVID. You know who needs to be convinced? The people of St. Lucia. It is the people who need to be convinced. We cannot be made to believe that we are doing so well that persons outside of St. Lucia are confident in us. Do they even understand what is happening within this country? You blame our fisher folk for bringing COVID-19 into St. Lucia, but you refuse to accept and state that even front door cases can test positive for COVID-19, even after initially producing a negative test. Madam President, I'm not buying it. There continues to be no accountability and no transparency. And what we have is more questions than we have answers. Now, Madam President, I spoke of second testing. And permit me to share with you why I believe it is absolutely important. Because this is the people that we say we care about. It is the citizens of this country. And as citizens of this country, we need to pay attention to what is going on around us. Not just in St. Lucia, but what our neighboring islands have been doing. Madam President, recently we learned of a COVID-19 outbreak on the first cruise ship to resume sailing in the Caribbean. After the ship was already sailing and these persons tested negative before boarding, they fell sick and tested positive for COVID-19. What does this tell you? There needs to be constant testing. Madam President, we have learned that the virus has an incubation period of 2 to 14 days. And there is a possibility that if you test your left nostril and the test came back negative, you could test your right nostril and the test can come back positive. These are the facts. You think I'm making it up? Let me explain to you, Madam President. Dr. Regina Bissett, a young woman of St. Lucian heritage. She's the emergency resident physician and medical director at Baylor College of Medicine in Houston, Texas. In a recent interview, when asked about testing negative one day and positive on the other day and about the incubation period of the virus, Dr. Bissett said, and I quote, "When you get the PCR test, you may be positive, but you aren't shedding enough of the viral particles for the PCR test to pick it up. And this situation, Madam President, exists, especially for asymptomatic patients." She further adds that this is why a negative PCR test isn't enough for us to hang our hats on right now. Madam President, these tests are not 100% sensitive. They are not my words because I am no health expert. All I am doing is coming here and translating what the experts say to allow the people of St. Lucia to better understand. You can never be too cautious. And even recently, the last example, Madam President, this morning, about 4 hours ago, over 30-something persons members of the team, the Pakistan cricket team.
Senator, you've given several examples and I've allowed them, but they must be tied to the purpose of the debate, to the bill. And it's about a loan and borrowing. So if you can tie it, this last example.
Thank you, Madam President. I will be very, very brief. This last example that I speak of is of the cricket team from Pakistan who went to New Zealand. And New Zealand, as we know, is extremely cautious with their healthcare system. They have been doing a very good job at managing COVID-19. These persons tested negative before they left their country. But when they got
Senator, I'll still require you to tie it to the loan.
Yes, Madam President, I am tying it. But when they got to New Zealand, they tested positive. All of this to say, Madam President, that there is a need to engage in additional testing. We must be able to also account for the money that we have borrowed so far, and judging by what we have heard here, we have not been able to do so. And that is my concern, Madam President. That is the concern of St. Lucians out there. We come, we say we are borrowing, and as I mentioned before, healthcare, it is a very important issue, because if we do not have a proper healthcare system, we may not have a country. And Madam President, as I mentioned before, there is a need to continue to support the efforts of those who have been affected. There are many persons who have been left without jobs. There are many persons who have even prepared and gone through the necessary precautions. And we think of the independent taxi drivers. They went through the training, they got the test, they have the equipment, and still they are not able to operate. A lot of our people in St. Lucia, a lot of our tour operators, various workers across various sectors are left without, Madam President. But, Madam President, the main issue that I have and the main concern is that if we cannot account for how these funds are going to be used, we will have to say that we are not able to trust this government and how it uses those funds. So, Madam President, there is certainly a lot to think about, and as a matter of priority, we are running out of time. And I need to again stress that without implementing additional precautionary measures, we may be left with nothing. We may be just risking rapid spread in our communities. And Madam President, the tourism industry that we depend on so greatly, we may just not have a tourism industry anymore. Because if we do not engage in that additional testing that I continue to emphasize on, our people will run sick. And the U.S. is already closing its borders to certain countries who are going higher and higher with their COVID-19 cases. So instead of blaming our people and saying you're not wearing your mask, put precautions in place to not just protect the tourists, but to protect everyone that the tourists might come in contact with. We must, Madam President, if I have not stressed it in the beginning, I will say it one last time. There is nothing wrong, in my opinion, with being extra cautious. The government has not been able to provide a reasonable explanation as to why additional testing is not being implemented. And I think it is extremely important for the people of St. Lucia to ask those questions of the government, that if you say you care so deeply about our people, you will do the right thing. Thank you.